Hello, my name is Dr. Brian Prax, and I am certified in functional medicine. Today the topic is going to be about foot support. This is called an orthotic. The company we work with most often is called Foot Levelers, and they make a phenomenal orthotic. Essentially what it's designed to do is help with the three arches of your feet in holding them into the proper alignment. And you might be wondering, for your peripheral neuropathy, for your back pain, neck pain, or even headaches, or knee pain, ankle pain, hip pain, you might be wondering, why do I need orthotics? I don't have foot pain. Well, it's a good question. If you remember the old song, it goes, the foot bone's connected to the knee bone, and the knee bone's connected to the hip bone. Well, truth be told, it actually is. That song is so true. So for most of us, as we go through life, there's injuries, there's trips, there's traumas, there's accidents. For myself, there was a basketball injury, a twisting of the foot. When I was a youngster, I wasn't walking around barefoot like we really are intended to. I was put in these really hard shoes because in 1969, okay, I just gave away my age, in 1969, that was the best thing to do. That's what the doctors recommended. Put them in a hard shoe. You want to get them in a hard shoe. It makes it so much easier to walk. Not true. Actually very bad. It doesn't allow for the arch to do its normal pronation. If we're looking at a foot head on, this would be a left foot. As we step down, hit the ground, what's supposed to happen is the foot is supposed to roll in. I'm exaggerating. It's supposed to roll in a little bit, and then we're going to toe off of our big toe. Well, the arch that's created by these bones right here are supported by muscles, little tiny intrinsic muscles and larger muscles of the foot, and those muscles even go up into the leg. So if you don't use it, you lose it. And in the case of the arch, if we don't use it, we're constantly in a shoe, especially things like high heels, that's jamming it into something, then you're gonna weaken the intrinsic and the other muscles of the foot. The arch is gonna drop. When the arch drops, what happens? The arch drops. Look what happens to the leg. The leg does this. What's connected to the other side? It's your knee. So a lot of times these buckling of the knee, we've got the knee up here that's grinding down like this. It's grinding itself out of alignment. Doctors take an x-ray when you're 68 years old and say, well, look at that. You don't have any cartilage. You got bone on bone. You need a new knee replacement. Might be true, might not, but maybe the knee is not a knee problem, maybe it's a foot problem. You got a hip problem, well, you got the knee up here, on the other side of that is the femur that goes into the hip, and what I'm trying to say is it affects all of the mechanics. We call it the kinetic chain, which is the foot bone's connected to the knee bone and the hip bone and the backbone. So for most people, we will scan the bottom of the feet, we're going to check those arches, we're going to make sure that you've got a good arch. If it's holding up and if you don't need an orthotic, if it ain't broke, we won't fix it. But for most people, we need to get them supported with a good orthotic that's going to support the medial arch, which is the inside arch, the lateral arch, the outside arch, and then there's an inside or transverse arch right there. These orthotics that we use are money back guarantee. I love them. They really help me out with my neuropathy patients, knee, hip, back. I've even personally had it help out with my chronic low back pain and even headaches for some people reporting. So that's the story of orthotics. That's the reason we wear those. When you come in for your evaluation, or if you're already in, make sure that we do, really pretty much for anybody, we're always going to check the feet because that's your foundation. So as always, if you have any further questions, you're interested in learning more about orthotics or the specials that Foot Levelers might have in order to order a pair, please call or ask. There's one last thing I wanted to share. The difference between these orthotics from Foot Levelers and the ones from the podiatrist is that these are not rock hard. I had a pair of those granite-like orthotics. They're super hard, ungiving whatsoever, and it doesn't allow for any of that pronation, normal pronation for the foot to roll in. These will squish. They'll squish down. They're nice and comfortable, so they make it comfortable, but at the same time they allow your body to go, your foot to go through that normal movement, that normal pronation, but stopping it from going through complete hyperpronation or overpronating, causing knee, hip, back problems. So that's it for today. Just wanted to talk to you a little bit about orthotics and how we use those to get our great results. I hope you have a great day.